Our correspondent, Habida Lawal. She is at the Nnamdi Azikiwe International Airport. We also have the coordinator, International Vaccine Access Center, Chizoba Wonodi. Good to have you join us, Chizoba Wonodi.
Thank you. Nice to be here.
Let's begin with you, Habida. What more can you tell us about all that played out today? Indeed, Nigerians were expectant. The date initially was January, but now Nigeria has received the vaccines. What more can you tell us?
Well, it is an historic event today at the cargo area of the Nnamdi Azikiwe International Airport. And we had present to receive this AstraZeneca Oxford vaccine from India, the PTF chairman, the health minister, the humanitarian affairs minister, the National Primary Healthcare Development Agency executive secretary, Mr. Faiza Shoaib, along with UNICEF, World Health Organization, the European Union, and many other development partners in the fight against COVID-19. And Nigeria is probably going to reach a fraction of its population percentage with this first batch of COVID-19 vaccine. And hopefully, as the year goes on, we are going to receive more vaccine so that it gets to the larger percentage of the population. And of course, there are worries, and as the SGF had rightly said earlier, that there needs to be education and information more put out to people that have that are skeptical about getting the dosage of COVID-19 vaccine. The fact that some persons think there will be some certain reaction based on what they heard from people, and these claims are not founded. And the SGF urged Nigerians to get administered with the vaccine. Precious.
All right, so let's take the conversation now to Chizoba. We have now received the much-awaited vaccine, but how prepared do you think we are as a nation, not just for storage, but also for distribution?
I think we're as prepared as we can be. The NPHCDA, National Primary Healthcare Development Agency, and partners have been working tirelessly since before Christmas to get us to this state of preparedness. Apart from the cold chain storage equipment that we are ready with, the NPHCDA has also established an electronic immunization registry system. So if you're aware, it's been passing around in some WhatsApp group, and that's a first for us as a country. So people can actually register online to get their vaccination number and be in line for vaccination. So we are prepared right down from cold chain to the strategy to deliver to the first priority people, to the data systems, and also the surveillance and pharmacovigilance systems that will ensure that if there are any side effects or severe side effects, that we catch them and we address them.
So there is a tendency, and I'm still speaking to you, Chizoba, there is a tendency for people to want to wait, it's like the case of the scapegoat. Let's see you take it. If you do not have any reaction, then I'll go take it. So how do we encourage people to register, to go to that website and register for these vaccines?
So you're right. There's a small proportion of people who say they wait, but I have to tell you that the majority of Nigerians are actually eager and waiting for this vaccine. More than 2/3 of Nigeria, when you survey them, they say yes, they will get the vaccine as soon as it's available. For those who are a bit skeptical, that's understandable because, it's a new vaccine. And what we've seen across the world is that as the vaccine rollout commences, that hesitancy actually drops because they see that their neighbors have taken it and then there's nothing, nothing happened to them. Or they speak to their neighbors who have taken it and they're fine. So I think that Nigerians should definitely register for the vaccination, and when it gets to their turn, they will be alerted by NPHCDA. But these vaccines have been used by millions of people right now across the world, and it's been found to be effective.
All right, Habida,
and safe.
All right, Habida, what more can you tell us about distribution? When is it expected to begin? And we understand that the president will take the first jab. Do we know when that will be?
Well, on 5th of March, that is on Friday, there is actually a center set up at the National Hospital in Abuja where healthcare workers will be forced to be administered with the vaccine. And with other development agencies as well, and strategic key leaders in the fight against COVID-19 will also be present to take the vaccine. And afterwards, the president and the vice president will communicate a date when they will be available to take the vaccine live air. Precious.
All right, thanks, Abida. To you, Chizoba, still talking about distribution, because we're staying on that. There are those who are genuinely afraid that we might see a situation of privileged access to these vaccines, where it becomes a situation where, those who seems like, are the elite, have access. It becomes a thing of power play or money play. Do you have that worry? And if you do, how do we ensure that that is not the case?
Yeah, I mean, people have that worry, but I can assure Nigerians that that's not going to be the case, because there is a clear-cut plan of how the people will be prioritized. First is healthcare workers, then healthcare workers, frontline workers in the ports and airports and all that. Then it's older people 50 years and above, and that's based on the evidence of our disease picture in Nigeria. But if you see the president take the vaccine, first of all, he's qualified to take the vaccine as one of the first people. But then the other thing it does is that it reassures Nigerians that these vaccines are safe, right? That if the president can take it and he's fine, then any other person can take it. So the priority groups will be adhered to by the NPHCDA and those who are vaccinating. So I really urge Nigerians to, have faith in the system that has been put in place. Register to get your vaccination, and then you will get your vaccine ID.
All right, thanks so much for talking to us. Coordinator, International Vaccine Access Center, Chizoba Wunudi. Thanks for talking to us.
You're welcome.